Welcome back. The time is now 7:14, and while many people have heard the term hernia, many still have questions about what a hernia is and how it can be treated. Touro Family Medicine Physician Dr. Meredith Maxwell is here to explain, as part of Hernia Awareness Month, what exactly hernias are and, more importantly, how to recognize them and treat them. Dr. Maxwell, good morning.
Good morning.
So let's backtrack. We've said the word hernia five times, but what exactly is a hernia?
A hernia is when an organ or tissue pushes through a weak area of your belly or abdominal wall. Sometimes they're congenital, which can be present at birth. Sometimes you can get one from straining or lifting or, doing too much weight over time. And if it's not treated, it can get worse with strain and stress and physical stress.
And so hernias are not, there's no one group of people or age group, gender, what have you, that is more prone to hernias. Anyone can get them, you're saying?
Not necessarily. It's just a weakness of the abdominal wall, and anybody can have that. And it looks kind of like a bulge underneath the skin, and it could get bigger when you stand up and smaller when you lay down. You could also feel some pressure or increase, like when you're coughing or lifting or going to the bathroom. And there's lots of different types. But usually your healthcare provider, your PCP, can just diagnose it just kind of by physical exam. Sometimes we'll get an ultrasound just to make sure, but it's easy to diagnose. Now, whether or not it needs to be fixed is a different ball of wax altogether, and that's a discussion that you need to have with your PCP.
And that's what I was going to ask you. If you do need it to be treated, what are the treatment options for hernias?
So usually a hernia is treated by small incisions in your belly called a laparoscopic surgery. That's not super, you're not in the hospital for a very, very long time unless it's a very complicated hernia. There's lots of different types, but usually it will not heal on its own, and it can get bigger. There are emergent situations where the intestine could push through the abdominal wall and blood supply could become cut off. So, if it becomes more painful, if it becomes, if it changes color, if there's swelling around the site, those are all kind of emergent signs. So don't not get your hernia looked at. Definitely know what type you have, what are the warning signs, and if you need to be referred to a surgeon for repair.
But as with most things, you just need to pay attention to what your body is telling you and any changes. And if you do notice changes or your body's telling you something more serious is happening, that's when you need to have a conversation with your doctor, correct?
Exactly. Always know your baseline, and you know your baseline best. So let us know if anything changes, and tell your doctor so we can figure out, do we need to watch it? Do we need to refer you? What are the things you can avoid doing to make it worsen? So basically that's kind of it in a nutshell.
Well, we appreciate your time as always, Dr. Maxwell. Some good reminders for people to pay attention to their bodies, but especially if they have a hernia during this Hernia Awareness Month. We appreciate you as always.
Of course.